So wanted to talk about gallbladder stuff today. So although I mostly am a hernia surgeon, the majority of things that I do are hernia surgeries. I probably do around 150 gallbladder surgeries a year on average, and I think they're great. When I first came out of residency, I actually had like this passionate project of wanting to do like only gallbladder surgeries. So I thought they were one really fun to do, and also really help people. And so the conversation that I usually have in clinic with gallbladder pathology in general is usually patients with gallstones, right? So usually you've been referred by your primary care doctor or the ER doctor had follow-up scheduled with the surgeon because you were diagnosed with gallstones on an ultrasound or a CAT scan, and it's a conversation with the surgeon about whether or not surgery is warranted. And so, in general, having gallstones is relatively common. We think somewhere around 1 in 5 people in America have gallstones. And we think that around 80% of people with gallstones are completely asymptomatic, meaning you have no symptoms, you don't know you have them, it affects your life zero. And the take home point in general for gallstone disease is if you have asymptomatic gallstones, do nothing about it. We don't recommend surgery in that situation. If you have symptomatic gallstone disease, we do recommend taking your gallbladder out for 2 reasons. One, it decreases the pain, stops the pain, right? So if you're having pain from those gallstones, if you take your gallbladder out, that pain is not there anymore. Two, it eliminates the chance of you having a gallstone related emergency in your life. And so that's essentially when a gallstone gets stuck in a bad spot, can cause things like complete blockage of your gallbladder, blockage of your bile ducts, or pancreas. And a common question I get is there any way to take just the stones out? Do you have to take the whole gallbladder out? Is there any sort of like cleanse I can do to just get rid of the gallstones while you leave the gallbladder behind? The answer to all those questions are no. There's no magic like vinegar cleanse to make the gallstones go away. There is a procedure to take the gallstones out, but it's a multi-step procedure where you put a tube in your side and sequentially upsize it over a period of weeks, and you eventually can suck the stones out. But that's a lot more morbid than just taking the gallbladder out itself. And when you do that procedure to suck the stones out, you have to make them really small and crystallized, and you have a chance of throwing them bad places. And in general, your stones will come back. Like even if you could magically take your gallstones out, you're a gallstone former at that point, you're going to reform them in the future. So in adults, there really is no reason that you need your gallbladder specifically. We can talk later about the rate of post-gallbladder surgery diarrhea, which is the one big thing that people talk about. The take-home point there is that in general, it's around 15% of people have a diarrhea that lasts for a few weeks after surgery. The overwhelming majority of people, that diarrhea goes away in the first 6 weeks. I've had 2 people in the past 5 years who have had a longer duration than that, but it always resolved anecdotally in my practice. We can talk more about that in a later video. But in general, the surgery to take your gallbladder out is safe, effective, takes around 45 minutes. You go home the same day.